I am Dr. Praveen Chandra, Chairman of Interventional Cardiology at Medanta Medicity Hospital in Gurugram, Delhi-NCR. Yeah, this is a fairly new therapy and it has been developed in the last 10 years, more than 10 years now, and this is known as TAVR, TAVR therapy, which means Transcatheter Aortic Valve Replacement, which in general means that we are replacing one of the valve of the heart without doing any surgery. This is a very interesting thing which has happened in this last many years worldwide, and the trends are like this, that in Europe and United States the number of valve replacements of the aortic valve of the heart, they have been done more with the without surgery approach, which is known as TAVR, rather than the surgical approach. So which means that the trend is changing. And the same thing is now happening in India, that now patients are being treated with TAVR treatment if they have a disease of the aortic valve, which is known as aortic stenosis. So, this is a very important question as to what is the need of this treatment when the surgery was doing well. The problem is that about 40% of those patients, even in India maybe more than 50% patients who actually required a valve replacement for this disease were actually not offered treatment because either they were too sick or they were too old or they were not able to undergo surgery or they were scared of surgery. So because of all these reasons, half of these patients were actually suffering from the problem but not getting any treatment, and there was no option. But now this new option can treat these patients without doing any surgery, which is low risk compared to surgery. It has less complications compared to surgery, and that is why TAVR is now being used in patients who have this problem and cannot undergo surgery. So basically this disease happens in both young and elderly patients, but at the moment those patients who are above the age of 60 years or 70 years or sometimes even 80 years, they are being taken for treatment by this therapy, because doing surgery in these cases sometimes it is difficult because they have already undergone some surgery or their lungs are weak. So that is where it is beneficial. We started with the valves which were being imported and are still being imported from US or Europe, but now only two companies are really making it, and one of them, the Merrill, has come as a commercial treatment because it has been now approved. Fortunately, an Indian company has started making these valves. We have already implanted about 75 or 80 of these valves, and they are working absolutely very nicely, same way as the imported valves. And we were conducting a study earlier, with the study was showing good results. So that is why the drug DCGI, or the drug controller in India, has already approved this valve to be used in patients, and this valve is working the same way as the imported one, the American ones, and really the results are looking very good. The patients are feeling equally good, they can be discharged very quickly, and of course they are far cheaper than their other counterparts. Yeah, so the Indian product is easily available, and the cost is, as I said, almost half or even lesser, and the long-term outcomes we have now is more than about 2 years. So we are quite satisfied and happy with the results of these made in India valves. So this made in India valves are really almost up to the same standards as the best of the valves made elsewhere in the world, and the results are equally comparable. The complication rates are extremely low.